Today, I want to bring attention to a more problem that often goes unnoticed in clinical care: the pressure for the culture of autism to appear as what we call normal. An awareness raised in the AMA Journal of Ethics article, "When Disability is Defined by Behavior, Outcome Measures Should Not Promote Passing." The article argues that many behavior therapies for autism prioritize making autistic individuals appear neurotypical, even when their traits like hand flapping, repetitive speech, or avoiding eye contact are not harmful or distressing. These behaviors are often natural expressions of how an autistic person interacts with the world. Yet many clinical outcome measures still treat the traits as deficits to be corrected rather than to be understood. This brings us to the core ethical problem. Is it justifiable to define progress in treatment by how well someone suppresses non-traditional traits that aren't harming anyone just because those traits challenge social norms? In doing so, therapy shifts away from supporting well-being and instead pushes conformity for the sake of others, treating difference as a defect rather than a diversity. Psychologically, the pressure to mask can be deeply harmful. It teaches autistic individuals that their true selves are not acceptable, statistically leading to identity conflict and a higher risk of anxiety, depression, and suicidal behavior. So let's talk about possible solutions. One solution is to redesign clinical outcome measures. Right now, autistic traits like eye contact or tone of voice are used to track progress in therapy. But instead, we could focus on whether the autistic person feels more comfortable, able to self-advocate, or is using communication style that works best for them. This directly benefits autistic individuals by reducing the pressure to perform in ways that feels unnatural, and instead supports their well-being and personal growth. Another option is to expand societal norms so that neurodiverse behaviors are more widely accepted. If society as a whole became more open to traits like stimming or avoiding eye contact, the autistic culture wouldn't be pressured to mask or hide who they are. That would help reduce long-term stigma and discrimination. But in short term, it doesn't change what happens in therapy today. So autistic individuals may still be pushed to suppress those traits now, just with the hope that things might improve eventually. Both solutions aim to reduce harm, but they work differently. Redesigning outcome measure helps now by easing therapy pressure, while changing societal norms could take years to make a real impact. So I argue that the more ethical solution is to redesign behavior outcome measures. This is where Kantian ethics gives us powerful clarity. Kant's principle of humanity tells us that we must always treat people as ends in themselves, recognizing and respecting their autonomy, their intrinsic worth, and their right to live authentically, and not merely as a means to someone else's goal, which includes goals like social conformity or fitting in. In this case, the autistic community are the rational beings. They have goals, preferences, and a right to self-expression. Solution 1 honors those values. It says, let's stop measuring therapy success based on how well someone hides who they are, and let's measure it by how well they're able to thrive as who they are. Redesigning outcome measure aligns with Kantian ethics in two key ways. By centering autonomy, therapy becomes about what supports the autistic person's well-being, and by addressing harm immediately. It removes moral and psychological pressure now, not later. It treats dignity as non-negotiable. Solution 2 fails Kant's test in two major ways. It delays justice. It asks autistic people to endure distress today while waiting for society to maybe become more inclusive later. And it uses people as a means to an idea. It places current suffering on the back burner to pursue future social change, violating Kant's demand for immediate respect and care for individual dignity. So while expanding norms may help long term, it doesn't stop the current harm. It shifts responsibility away from the professionals, allowing continued harmful practices without taking responsibility for the person in front of them. Instead of changing their methods now, they can defer change to some vague future. That's something Kant would not accept. Redesigning outcome measures centers the person receiving care right now. It says, let's not make them adapt to our system. Let's make the system adapt to them. That's what treating someone as an end looks like. It respects individuality, honors autonomy, and prevents avoidable harm, which makes solution one a better fit. Some may worry that changing therapy goals could confuse families, but the stress caused by just to meet other expectation treats the child as a mean, not a person. Kant is clear. Autonomy and dignity come first. Redesigning outcome measure is the only solution that upholds those values and treats people as ends in themselves. Thank you.